By way of introduction, I'm going to welcome you to Physicians Regional Hospital here in Naples, Florida. My name is Robert Zehr. I'm an orthopedic surgeon. I've been here in Naples now for 12 years. I was part of the Cleveland Clinic when I first came down here. The last 3 years I've been in private practice, and I primarily focus on dealing with hip and knee replacements. We're going to move on to knees. Now here's our friend the x-ray. The x-ray doesn't say anything. All it tells me by looking at it is, wow, there's no articular cartilage. That's bone on bone. And you're pretty worn out based on all these spurs underneath your kneecap. So what do we end up doing? Is going to be a knee replacement, assuming what? That all of those other steps have been tried and failed is the answer. Traditionally, knee replacements were done through about an 8-inch incision. So the usual incision, and most surgeons that do very few hips and knees are going to make big incisions, and that's a more traditional look. And we try to do it through a much more abbreviated incision, and 4 inches, as you'll see, is about as small as we can go. Because we have to get that cap on the end of your thigh bone, we have to get that tray on your shin bone with that piece of plastic that the knuckles glide on, and behind my thumb is your kneecap with a little piece of plastic, and that's about as small as I could make the incision and still get in all of those parts without cutting way up your thigh and cutting all kinds of tissues that we don't want to cut. And that's what it looks like when we're done, about 4 inches, and most importantly, she's up the same day of surgery. One of the big advancements in surgery from my residency days was you'd get your joint done, you'd lie in bed and nap and watch TV, and nobody expected you to get out of bed. And the next day you'd maybe walk to the door, and the next day maybe walk out in the hallway, and 14 days later you were either going home or off for more rehab. No more of that nonsense. You're up walking right after surgery. As soon as your eyelids are open and we get you on your floor, you are up walking around. This is that lady whose x-ray, or excuse me, that operation that you just saw. Her knees wrapped up, and what do you notice here? She's dressed up in street clothes. We do that for all kind of reasons, but underlying our motivation is psychology. If you're dressed up in a hospital gown, you innately feel sick. We don't want you sick. You didn't start out sick that morning. You're not sick after surgery. You just put on your street clothes and have at it and start walking. We're not going to let you feel sick. So you get dressed, regular clothes, and you're up walking around. This is that lady the day after surgery, the dressing's off. She'd had her other knee done by another fella in town here through a more traditional 8-inch incision. That's the incision that we did. And here she is bending her knee the first day of surgery. Now, not everybody can do that, mind you, and the first day is easier because the blood thinner hasn't kicked in. When your blood thinner kicks in, your knee fills up with blood and it gets harder. That's why we do these pictures the first day, because you're bending a lot better. Second and third day, your knee is a lot more swollen and it's harder to bend, but there you go. So there she is bending, and she's got very good control of her leg there. Doesn't that look nice? So that's the day after surgery, and that's pretty typical. We expect that. We set realistic expectations, and we're not going to let you dog it just because you don't feel quite up to it, because we're going to make you feel up to it. Now, here's this sort of rehab protocol, rapid recovery, all kind of names go along with it, but essentially we want you up walking the same day of surgery. As soon as you're up, some people get a little sick after anesthesia, but barring that, you're up walking with the therapist pronto. We only use pills. I don't use IV narcotics. All those things make you crazy. They clog you up, and it just slows you down. So we use pills, and I like Coumadin as a blood thinner. People sometimes use aspirin. Sometimes they use little shots in your belly. It's whatever your surgeon's comfortable with to try to keep you from getting one of the dread complications, which is blood clots. So we use that. We send virtually everybody home on day 2. All the potential terrible things, strokes, heart attacks, all those generally happen in the first 48 hours. After that, you're just collecting everybody's germs while you're hanging around in the hospital. So we send you home at day 2. Now, some people plead and beg, please let me go to a rehab facility, which I'm not a big fan of, but I let them go. They have to stay day 3 because Medicare makes you stay an extra day. Odd as that may be, they really like to save money, but they want you to stay in the hospital an extra day. So most people go home, a handful will go off to rehab. Those are usually the more frail people, live by themselves. But if there's any decent support mechanism at your home, I want you to go home. When you get up in the middle of the night, the bathroom's there, the kitchen's there, my dog sleeps over there, you know exactly what's going on, and it's better at home. You feel more like yourself and you recover mentally better at home. Most people are on a cane in 1 week with a hip, 10 days to 2 weeks with a knee replacement. We want you to aim for being back to full activity by 4 or at latest 6 weeks. And full activity is all those golfing, swimming, biking. Tennis usually takes closer to 6 weeks because your blood count's low right after surgery, and the stamina it takes to run around the tennis court normally takes a little longer than golf does. Golf is more of a hand-eye coordination mental game. Long distance walking and return to work are all reasonable by 4 to 6 weeks in the working population. Now, the little asterisk is here because if you're a couch potato before surgery, you're not an Olympian 4 weeks later recovering from hip and knee surgery. So assuming you're reasonably fit coming in, those dates are very realistic. If you're kind of a pudge and you never saw the inside of a gym in your life, this is not going to likely be your outcome. It just doesn't work that way because people don't understand that no pain, no gain concept, and it takes me every bit of 6 weeks to sink that into people. So this is important that you understand, but this is realistic for the vast majority of people. Now this brave soul, I did 2 knees on. I'll tell you at the question and answer period, I don't do that very often. It often is not necessary. But this brave soul came in at about 7 to 8 days. We took out his staples. He brought his walker, and just for video, I was trying to do a talk. I said, well, get up and walk. I want to take a picture. And he just got up and left his walker in the corner and just started strolling down the hallway there. Now, that's 2 knee replacements just over a week. Now, I thought that was pretty impressive, so I was videotaping. And you always got somebody going, hey, my appointment was a half an hour ago. You're late. What's with that? I'm out here doing movies. Anyway, so he's walking along and he's doing just fine. And nobody's going to put their dog patience on a movie that we're showing in front of hundreds of people all the time here. But in reality, that's a pretty typical outcome. This guy's stronger than some, but he's not stronger than most. And he's got very good control of his legs, and this is what I wanted to show you. So he's moving around and doing very well at a week. And that's what those are the expectations that I will set for you. If you're not doing that, I'm going to wonder why.